Hello everyone. Today our topic is adjustment disorder and its symptoms and causes. Adjustment disorder is very common. In fact, experiencing a dramatic event is much more common than most people realize. A large-scale studies have found that most people will experience some kind of traumatic event at some point in their lives. Even more common enduring stressful life events. Stressful life events may include traumatic events, that is, involve life threat and the experience of life, a fear, hopelessness. And however, there also include events that tax our coping resources, such as a divorce or the loss of a job. And the stressful life events such as this can be very difficult to cope with and can have a major impact on a person's life. However, according to the DSM, the four strategy, they cannot lead to the development of PTSD. Instead, they can lead to something called adjustment disorder. This is not surprising given that everyone is going to experience some kind of stressful event at some point in their life. Here, let's talk about the symptoms. Adjustment disorder is a mental health condition that describes difficulties acclimating or responding to a stressor. It includes the following symptoms. First, the development of emotional or behavior symptoms as the result of a stressful life event. The symptoms occur within 3 months from the start of the stressful event. And second, these symptoms cause distress that is greater than what one might expect to experience in response to the stressful life event. The symptoms interfere with parts of the person's life, such as at work, school, or in relationships. The symptoms are not the result of another disorder, such as major depression or an anxiety disorder. And the fourth one, the symptoms are not related to very relevant about the loss of a loved one. And the last but not the least, once the stressor has ended, the symptoms go away within 6 months. If a person has an adjustment disorder, they may experience depressed or anxious mood. They may also experience problems in behaving appropriately. For example, a person with adjustment disorder may increase their alcohol consumption as a way of trying to cope with the stressors. In my opinion, for adjustment disorders people, when they are children, if they heard of that their parents will get another children, for example, oh, I will get a little brother, a little sister, but I will lose my parents' love, and my parents won't love me anymore. Oh my God, like this. And when they go to school, their parents at that day, the professor didn't call their name. Oh, what happened to me? My professor didn't call me. Oh, I must do something wrong, and I won't get an A in my examination. And at the final, if they didn't get an A at the examination, oh my God, I can't graduate I can't graduate from this school. Oh, I can't get good job. Oh my God! And if they are in one relationship, they broke with their good boyfriend or girlfriend. Oh, I won't find my true love. I can't find my dream girl, dream boy. Oh, that's the end of my life. And in their family, oh, when they build up a family, oh, when I lose a job, I can't support my family. Oh, I have to say sorry to my family. Oh, that is, I think they can't deal with uh, their own issues in their life. Here, let's talk about the causes. The exact cause of adjustment disorder is not known. Like other mental disorders, the cause is probably multifaceted and may involve the genetics, your life experience, your temperament, and even changes in the natural chemical in the brain. Next, finally, let's talk about how to better cope. Even though stressful events and adjustment disorder are common, there are things you can do to help you better cope with these events and reduce your chances of developing adjustment disorder. For example, seeking out social support and problem solving health ways of getting through a stressful life event. I believe some of you are still confused about the treatment of the adjustment argument. Here, I will talk about the primary goal of treatment is to relieve symptoms and help the person achieve a level of functioning and comparable to that prior to the stressful event. And recommended treatment include individual psychotherapy, family therapy, behavior therapy, and self-help groups. Realistic short-term goals should be made at the start of therapy, as the course of adjustment disorder is short-term in nature. Goals of therapy will often center around social supports available to the individual in the form of family, friends, and community. The individual's coping and problem-solving skills will be explored and developed. Relaxation techniques might be explored to deal with feelings of stress. Treatment will include educating the patient's conscience and helping the individual understand his or her role in the stressors. Reviewing and teaching ways to cope or avoid stressors in the future. Helping the individual place stressors in perspective to overall life. Helping the individual to understand his or her reaction to the stressors and helping the individual view stressors as a chance for positive change or improvement. And family therapy as well as effective communications and coping with stress skills may be recommended for cases in which the patient is younger. When medication is used, it is typically in addition to psychotherapy. Pre Prescription medicines might be helpful in easing, easing the depression or the anxiety associated with adjustment disorder. However, treatment of adjustment disorders usually exclude use of medication. Most people recovered from adjustment disorder without any remaining therapies with, without any remaining symptoms if they have no previous history of mental illness and have access to stable social support. Individuals suffering from adjustment disorder should work with develop and maintain a healthy diet and sleep patterns, as well as strong social support systems. That's all. That's all for today. Thank you.